Welcome, everyone. Thanks so much for joining us today for a very special Q&A with Dr. Chandra Ford and Natalie Bradford, both of the UCLA Fielding School. Just a few housekeeping notes before we begin. We're streaming live on the UCLA Fielding School's Twitter and Facebook accounts, and we're also streaming on our school's YouTube channel. We're recording the session as well, which will be available on the Fielding School's website after this broadcast. The questions were submitted last week by community members via social media and email, and those questions will be prioritized today, but you're welcome to type in a question that you might have in the comments section, so just below of the platform that you're watching on, and we'll get to as many of those as we can. So we're extremely grateful to Dr. Ford and Natalie for making time to be with us today, and it's my absolute pleasure to get us started by introducing Natalie Bradford. Natalie is a doctoral candidate in the Department of Health Policy and Management at the UCLA Fielding School of Public Health, and she's also a graduate student researcher with the Center for the Study of Racism, Social Justice, and Health, which is led by Dr. Ford. Natalie contributed to and served as project manager for the book Racism, Science and Tools for the Public Health Professional, which was published in 2019. And this seminal book draws on decades of research and community work. And in one of the appendices, Natalie describes 3 community-based anti-racism projects. Each of these projects includes policy change as a strategy to address racism and advance health equity. And in Natalie's dissertation, she uses critical race theory to examine the relationship between racial residential segregation and the expansion of community health centers under the Affordable Care Act. The work that Natalie is doing is incredibly important, and I'm so appreciative of her making time to lead our Q&A with Dr. Ford today. Natalie?
Thanks, Carla, and hello, everyone. I am really excited to be a part of this conversation with you all through this Q&A. I'm excited to be in conversation with Dr. Chandra Ford, who I also have the pleasure of introducing. So Dr. Ford is the founding director of the Center for the Study of Racism, Social Justice, and Health, and a professor of community health sciences at the UCLA Fielding School of Public Health. Dr. Ford's expertise includes offering conceptual and methodological tools for studying racism as a public health problem. In collaboration with Dr. Kalanzari and Bua, Dr. Ford originated the Public Health Critical Race Praxis, which is a framework for applying critical race theory empirically. Much of her empirical work examines inequities in HIV testing, care, and prognosis, and documents barriers to services among LGBTQ survivors of intimate partner violence. In her role as founding director of the Center for the Study of Racism, Social Justice, and Health, she led the formation of the COVID-19 Task Force on Racism and Equity in March 2020 to explicitly focus on the documentation of and responses to issues pertaining to health and social inequities in regards to the pandemic. She is also lead editor of the book, Racism, Science and Tools for the Public Health Professional, which was named an outstanding academic title for 2020 by the American Library Association's Choice magazine. Dr. Ford, welcome.
Thank you, Natalie. It's a joy to be here with you.
Yes, indeed. Well, I say we'll just go ahead and get into these questions.
Let's get right into it.
All right. Well, the first question I'll ask is one that it begins really where your bio began, and it focuses on the center. And so the question states, well, it starts with a comment. You started the Center for the Study of Racism, Social Justice, and Health at the Fielding School of Public Health. You were already a leader in this research area. Why was it important to create the center? And I'm gonna quickly add two things to that question. So it's a three-part question. Why was it important to create the center in a school of public health? And why was it important to include the terms racism and social justice in the center's name?
Natalie, I know I can count on you to ask small questions.
Let me know if you need me to repeat these small questions.
Okay. Well, first I want to start by thanking the Fielding School for hosting this event, and also thanking you for participating and introducing me. And that was a very generous introduction. I do want to highlight, though, in terms of the COVID Task Force on Racism and Equity, that Bita Amani, my colleague at Charles R. Drew University, is really my co-chair and lead chair, really in many ways, of the COVID Task Force. And I would be remiss in not highlighting Bita's role with that work on the task force. It was important to start the center, and it might seem a little bit self-evident in 2021 that we need to think about racism as a public health issue. And in 2017, when the center actually launched, that wasn't quite as self-evident, even though there was a growing body of work in the area of racism and health. For me, though, I had been interested in a center for quite some time, a center focused on the health implications of racism. And so much of the ways that we think about research in public health is it needs to be rigorous, and that has a very particular connotation that has to do with methodological rigor, as well as conceptual and theoretical rigor. And for those of us who've been doing work in the area of racism for a long time, we often have our work reduced to what I call Racism 101. And so we are asked to talk about racism on such a superficial level. And it is important that that work happens so that people can get introduced to it. But what it does, it keeps us from being able to go deeper in terms of, really developing the level of depth and expertise and rigor for this particular area of study that we would associate with any other area of study. So for that reason, I wanted to create a space where people who are doing this work could communicate and engage and work with others in order to deepen the work that they are doing, number one, and also centering the perspectives that Black, Indigenous, and people of color do bring to this type of work that they're doing, so that the center itself would become a way of embodying the principles of critical race theory in advancing empirical work within public health. So those are two of the three questions. And then why racism, social justice, and health? So racism is a problem. And it could be that we just simply focus on, for instance, the social determinants of health, or that the center be named as Center on Health Equity. We already have a lot of focus on health equity. For me to have chosen a name like that would have been an intentional compromise with my focus on racism. So it's not to say that we don't need centers dedicated to the study of health equity. In fact, the work that people have done using language like health equity, health disparities, I would say is work that we now build on because people have not used the term racism in the past. They've actually helped to move things a little bit further so that we now can use that word. And I would say have a responsibility to use that word. I am aware that I was actually pushing things when I insisted on having that word in the name of the center, but it was absolutely critical for me, in part because of my orientation as what I call a health crit. That is, one who uses critical race theory and tries to rely upon critical race theory to advance health equity. From that perspective, not to name racism explicitly would need to be a very conscious choice. And in this case, I thought that to not name racism would be a compromise that was not necessary. It wasn't serving any strategic purpose. And in the 21st century, we have come to know that naming is so critical, as former APHA president Kamara Jones has really fought for this, literally for a couple of decades, to name racism explicitly. And so that's why naming racism was important. Social justice is important because it gives us some tools for thinking about what do we do about it. And again, with respect to the center, a big vision has been not just to find the problem, which is what we in public health are trained to do very well, but to think about how do we solve the problem. And that's also an area that public health people are trained to do. But how can we approach problem solving in a way that taps into the struggles that people who are not credentialed as public health professionals, for instance, might use? And can the use of the term social justice help to legitimate work that is connected to community in those ways? So that's why those are some considerations that were very important for me in thinking about the name of the center.
Wow, that's a lot. That's excellent. You said a couple things that really stand out to me, which helps to kind of transition into our next question. One of the things you talked about starting the center when it might not have been so evident that, or at least to some, that racism is a public health issue. And you also talked about critical race theory. The next question that was submitted is a question about critical race theory. And so the question is, again, beginning with a statement, there is a lot of discussion about critical race theory in law, and especially in education. How is critical race theory relevant to the field of public health right now?
That is a very, I really appreciate that question. It has been a little over a decade since Collins, Ari, and Bua and I published those first papers that intended to try to advance a public health specific version of critical race theory, or really a call to embrace critical race theory more seriously within public health. I think there are a number of ways that critical race theory is relevant to public health right now in this moment. First of all, as we look at this pandemic, I mean, there are so many ways that we can think about the salience of both public health and critical race theory, and racism. And for me, that intersection right there is public health, critical race praxis. It is critical race theory. So we in public health are trained to identify problems. We're trained to look for exposures. And I actually believe that many of us were trained for a moment such as this pandemic. So the opportunity to jump in and solve these big problems. How many of us in that training expected it to be racialized in the ways that it has been? So critical race theory is, and it always has been as it originated in law, concerned about this question of perception and the ability to recognize and perceive these racialized dynamics that may not otherwise be apparent, in particular after the civil rights gains of the late 1960s and early 70s. And so in this moment, if we try to think about, this pandemic and the emergence of critical race theory within public health as essentially, or, I don't want to stretch this too much, but let's imagine it as an echo of the emergence of critical race theory in law. That we can see that in this moment, there is much that can be explained through the lens of critical race theory. Critical race theory offers us ways to describe what it is that we're seeing and why it's racialized in the ways that it is. And so I think that critical race theory is relevant to public health right now because what we're seeing in public health right now is having such a profound effect on communities. And we in public health are trained to recognize what has already been described as the health dimensions of it, the biomedical dimensions of it. We're not so good at recognizing the racialized dimensions of it. And if we in public health walk away from this moment thinking we understand the problem because we have understood it biomedically or through the lens of public health that's disconnected from deep understandings of racialization, I'm 100% sure that what we will see is, number one, the persistence of racialized inequities. And another thing that will happen is that we'll be wondering why we haven't ended this racism problem in a short period of time. So critical race theory is relevant to public health because racism pervades every dimension of our lives. Critical race theory is one tool that helps us to understand and explain those dynamics. And I could go on and on about that. So I would say it's absolutely critical. And I would like to see more discussion in the media and elsewhere. That there's a lot of discussion now about critical race theory in schools. And I would like to see more discussion about it in the context of public health, given public health is by its very nature a government entity, right? Public is, defines it as related to the government. And we haven't really seen a lot of discourse about that in the media. So I'll stop there.
Wow, thank you. You mentioned in your response to that question, obviously the pandemic, right with the last question, thinking about right now, the times right now being in the pandemic. The next question focuses on the task force, the COVID-19 task force on racism and equity. So someone asked, your center formed a task force in the early days of the COVID-19 pandemic. What are some of the top lessons public health agencies should draw from what your task force has learned, especially in terms of planning ahead for a similar crisis in the future?
I appreciate that question because I sit on an academic, in an academic setting, and that also reminds me to just convey that I also sit and work on lands formerly cared for and inhabited by the Gabrielino Tongva peoples. The task force was formed, in this academic context in a way, though it has involved many non-academic members. And a part of what we are charged with doing is taking all of this seemingly academic work, research, critical race theory, and making it meaningful for reducing health disparities. So we sought to use the tools readily available to us. The tools that we could draw on most rapidly were our time and effort, our knowledge, our ability to do certain kinds of statistical analyses and those kinds of things, and then to share those results with policymakers, with community members, with the general public as we could, first and foremost, to signal, hey, there is going to be a problem here with respect to health disparities, and we're seeing all the red signs. We're seeing all the red flags already. So that was important to us. What lesson did we learn from that? We learned that the evidence may not by itself be sufficient to motivate action with respect to health disparities. And I would say we learned that, but this is something that people have been talking about for some time. Health disparities are not new. So one lesson we take away from this is, what are strategies that we can use? We take away the need to figure out strategies to motivate action, to address health disparities, not necessarily just to document them.
Mm. Something related to, well, yeah, still on the topic then of the task force. This question is related to an open letter that members of the task force co-wrote. So the question is, in April 2020, you co-wrote an open letter about the need to prioritize equity in policy responses to the COVID-19 pandemic. Can you share why it was important to make that statement publicly?
On some level, and I think this is the part of me that wants to connect the work with what community are doing. It was really to make the call to all policymakers and all those in positions to take some action, and also to make it clear that we are calling out. And part of that is we actually had reached out to policymakers through letters and sort of behind the scenes, and we really got a few responses, but not many. And so making it public was a way of just really trying to get that out there.
Well, with the last couple of minutes that we have, I would love to kind of switch gears a little bit, because we have a couple of questions from students. So, well, not to say the previous ones weren't from students, but these focus specifically on advice for students. So someone asked, what advice do you have for public health students committed to work on health and racism?
One tension that I have observed over the last decade or so is that students who are interested in challenging the system also sometimes feel petition the system for support, guidance, and validation. And I believe it's really important to recognize that if one is challenging the system, one also has to be aware of what does it mean to also rely upon that system for whatever it is that you're seeking. So how do you ask questions about racism on the one hand and challenge institutions, and at the same time ask those institutions to support the research agendas that you want to build? So there is not an easy answer to that. And I sit here in the university as one who struggles with this all the time. And I think the struggle itself is the uncomfortable place that we have to just be, from which we make our decisions. So one thing I would say for students is to push yourself harder than you think you can, not just in terms of the work, but what I'm saying here is work not to censor yourself, but to advance the work that you want to do without trying to reduce the significance that you get, that you associate with, for instance, will this get me a job? So that's just based on one of the many questions that I frequently get from students. That's probably like one of the most common. Well, if I get a job, will I get a job if I'm doing this? And I would say that think less about getting the job and more about what it is that's motivating your passion. What is the passion? What's motivating it? How can you pursue that?
Definitely. I appreciate you mentioning that tension and really the uncomfortable place of the struggle, because that can have a huge emotional toll, which is related to the next question. there's an emotional toll that comes with doing work like this. How do you manage that, and what advice do you have for others on a similar path?
Mm-hmm. The emotional toll is real. Anyone who's done this work for a long time can tell you that. I think in particular of Black women, Black feminists, not just as a category of people, but because whether by choice or because it's been imposed upon us, Black women have repeatedly spoken out and paid the penalty for it. And so in this moment, many people are benefiting from the work of Black women. Many of whom I know personally have suffered in silence sometimes or otherwise. So recognizing the difficulty and finding ways to express it through poetry, through music, through dance, through communion with your friends and family, through communion with nature, through your faith, those are absolutely essential for survival as an individual, but also for the work so that the work stays meaningful and relevant and useful.
Thank you for that. Amazing. Well, we only have a couple of minutes left. So as we close, Dr. Ford, is there anything that you would like to share before we go?
I would say that, the journey has been very difficult at times, but it has been made so much more joyous to share it with my students like you, Natalie, and the family at the center in particular. And so I feel very fortunate and blessed and grateful for the challenges I've had and the fruit of the work. And I look forward to continuing it. Thank you for that question.
Wow, thank you for that response. Well, Dr. Ford, one last time, thank you very much. Thank you for your time. Thank you for your insights. Thank you for your work and your generosity and sharing all of that with us today and all the days that you do that. Also, shout out to everyone who's tuning in. Thank you for being here, and take care.